Here are 15 Puerto Rico Medical Board-style clinical vignettes focused on anemias and coagulopathies first-line treatments, each with 4 answer choices and explanations. Anemias and coagulopathies, clinical vignettes, first-line treatment. Anemias. 1. Iron deficiency anemia. A 25-year-old woman presents with fatigue, pallor, and pica, craving for ice. Labs show low hemoglobin, low MCV, low ferritin, and high TIBC. What is the first-line treatment? A. IV iron infusion. B. Oral ferrous sulfate. C. Blood transfusion. D. Folate supplementation. Answer B. Oral ferrous sulfate. Explanation: oral iron ferrous sulfate is the first-line treatment for iron deficiency anemia unless malabsorption or severe anemia requires IV iron. Vitamin B12 deficiency anemia. A 70-year-old woman with a history of pernicious anemia presents with paresthesias and macrocytic anemia. What is the first-line treatment? A. Folic acid supplementation. B. Oral vitamin B12. C. IM vitamin B12 injections. D. Iron supplementation. Answer C. IM vitamin B12 injections. IM B12 injections are required in pernicious anemia due to intrinsic factor deficiency and poor GI absorption. 3. Folate deficiency anemia. A 32-year-old pregnant woman presents with macrocytic anemia and normal methylmalonic acid levels. What is the first-line treatment? A. Vitamin B12 supplementation. B. Oral folic acid. C. Iron supplementation. D. Blood transfusion. Answer B. Oral folic acid. Explanation: oral folic acid is first-line, especially in pregnancy, to prevent neural tube defects. 4. Anemia of chronic disease. A 65-year-old man with rheumatoid arthritis has normal cytic anemia, low serum iron, and low TIBC. What is the first-line treatment? A. Iron supplements. B. Blood transfusion. C. Erythropoiesis-stimulating agents, ESAs. D. Steroids. Answer C. Erythropoiesis-stimulating agents. Explanation: erythropoietin, epoetin alpha, is used in anemia of chronic disease, especially in CKD or inflammatory conditions. 5. Hemolytic anemia. Autoimmune hemolytic anemia, AIHA. A 45-year-old woman with positive direct Coombs test and spherocytes on blood smear has fatigue and jaundice. What is the first-line treatment? A. Rituximab. B. Corticosteroids. C. Plasmapheresis. D. IV immunoglobulin. Answer B. Corticosteroids. Explanation: steroids are first line for warm AIHA. Rituximab or splenectomy is second line. 6. Sickle cell disease acute pain crisis. A 10-year-old boy with sickle cell disease presents with severe bone pain, low hemoglobin, and dactylitis. What is the first-line treatment? A. NSAIDs. B. IV fluids and opioids. C. Hydroxyurea. D. Blood transfusion. Answer B. IV fluids and opioids. Explanation: fluids and pain management, opioids, are first line for acute sickle cell crisis. Hydroxyurea is for prevention. G6PD deficiency anemia. A 30-year-old man develops acute hemolysis after taking sulfa drugs. Blood smear shows Heinz bodies and bite cells. What is the first-line treatment? A. Iron supplements. B. IV corticosteroids. C. Avoidance of oxidative stressors. D. Plasmapheresis. Answer C. Avoidance of oxidative stressors. Explanation: avoidance of triggers, fava beans, sulfa drugs is the best management. Coagulopathies. 8. Hemophilia A, factor VIII deficiency. A 5-year-old boy with a history of easy bruising and hemarthrosis has low factor VIII levels. What is the first-line treatment? A. Fresh frozen plasma. B. Cryoprecipitate. C. Desmopressin. DDAVP for mild cases. Factor VIII replacement for severe cases. D. Vitamin K. Answer C. Desmopressin DDVP for mild cases. Factor VIII replacement for severe cases. Explanation: DDAVP is used in mild hemophilia A, while severe cases require factor VIII infusion. 9. Hemophilia B, factor IX deficiency. A 7-year-old boy with prolonged bleeding after minor trauma has low factor IX levels. What is the first-line treatment? A. Desmopressin. B. Factor IX replacement therapy. C. Vitamin K. D. Answer B. Factor IX replacement therapy. Explanation: factor IX replacement is the first-line treatment. Chat 10. Von Willebrand disease. A 22-year-old woman has menorrhagia, easy bruising, and prolonged bleeding time. What is the first-line treatment? A. Factor VIII infusion. B. Desmo VP. C. Plasmapheresis. D. Corticosteroids. Answer B. Desmopressin. Explanation: DDAVP increases VWF release from endothelial cells. 11. Disseminated intravascular coagulation, DITES. A patient with sepsis develops bleeding, thrombocytopenia, and high D-dimer. What is the first-line treatment? A. Fresh frozen plasma, FFP, and treat underlying cause. B. Aspirin. C. Heparin. D. Rituximab. Answer A. Fresh frozen plasma, FFP, and treat underlying cause. Explanation: DIC treatment focuses on addressing the underlying cause and replacing clotting factors. 12. Immune thrombocytopenic purpura, ITP. A 35-year-old woman has petechiae and a platelet count of 10,000. What is the first-line treatment? A. IVG or corticosteroids. B. Platelet transfusion. C. Plasmapheresis. Aspirin. Answer A, or corticosteroids. Explanation: steroids or IVIG increase platelet count in ITP. 13. Thrombotic thrombocytopenic purpura, TTP. A patient with fever, anemia, thrombocytopenia, and neurologic symptoms has schistocytes on blood smear. What is the first-line treatment? A. Plasmapheresis. B. Steroids. C. Aspirin. D. Heparin. Answer A. Plasmapheresis. Explanation: plasmapheresis removes ADAMTS13 autoantibodies in TTP. Would you like